Well, I appreciate the chance to tell a story because that's something, of course, I really enjoy, as do family physicians especially. It's one of our strengths. So I'll share a little of mine because I really never wanted to be a doctor. I mean, you'll talk to a lot of people who'll say, "Oh, yes, I knew from the moment I could think." Well, I didn't. I was, in fact, determined probably not to be a physician. I'd worked in a hospital as a summer job in college, and really didn't feel pulled from what I saw. I saw some amazing things go on and met some remarkable people, but it didn't really attract me. So I was in college up in Haverford at Philadelphia, as you had said, and I was working on biology as my major. And I did a lot of research there. I enjoyed what I was doing, but then I said, gosh, is this really what I want to do with my life? And I realized it wasn't. And so I had a lot of soul searching and talked to family and friends and mentors and decided that maybe medical school really was a way to go. I'd met some amazing people. I talked with them and decided to go ahead and apply. So I applied to medical school and was accepted. I went back home to Atlanta where I was born, and I went to Emory. I had a chance to go to Emory University, and was really amazed. It was just a phenomenal experience. The people who know Emory know that the teaching hospital there is Grady Hospital, which is one of those sort of classic old-style scary places to hear about, like Bellevue and Cook County. Yeah, it's one of those you just go, oh my God. And of course, anyone who went to Grady has great stories, and we could tell all kinds of things, and most of them are really fairly true. But I won't go into those stories. But I went to Emory, and at the time I was there, Emory was one of the orphan schools, did not have family medicine.
Really?
I didn't even know what family medicine was. Oh yeah, you did not go to Emory to go to family medicine back when I was there. So I'm going on my. I had two amazing experiences. One of them was when I started on junior rotations. I had a chance. I started on OB. So I'm getting to deliver a baby, and just it's truly one of the most amazing and awesome experiences ever. And I said, God, this is fantastic. And then I went on other rotations, and I kind of had the same experience. I said, oh my God, this is phenomenal. I love this. And then somebody came to me and said, okay, you've got to choose. Which of these specialties you're going to do? And I said, but I don't want to choose. Can't I do more? And they finally, reluctantly, because again, this is not a family medicine friendly place at the time. A lot of changes now, but at the time, they weren't into it. They finally said, okay, there's this guy you can go talk to in the basement of a building across the street. So, in my mind, what I remember now, I know this is not entirely true, but I remember going across the street to the basement, and I walk in. There's a wonderful man named Bob Curry who's in charge of the Physician's Assistance Program, but he also was the one contact for the very rare Emory student who wanted to do family medicine. So he sort of dusted off a book, and we talked, and I sort of got some insights on how to pursue it. That was one aspect. The other one was a phenomenal mentor, a guy named Andy Morley, family physician from Decatur, Georgia. In fact, he was one of the leaders of the academy. I did not know that at the time, but he ended up serving on the board of directors. He was considering running for president-elect of the academy. Just an amazing man. And so I'm sitting there in the middle of between sessions at Emory. So I think this was actually just before my junior year. I'm a sophomore, and the American Cancer Society created an opportunity. I worked with him as a private doc. Had no idea what family medicine was. As I said, they didn't teach us. So I show up there, and I think on the first day, we're in the office. There's a patient there for a vasectomy. We have patients for health maintenance. We have people with acute problems. We then go to the hospital the next day and make rounds to the nursing home the next. And again, my eyes just got big. I was like, who is this man? And what is this experience? Because we were seeing kids and women and doing procedures. It was an incredible experience. And that's really what started me to go to the path of family medicine. I saw that experience. I saw the impact you can make on everybody, and not just on. You're not treating diseases. You're treating people. You're treating families, and it was a phenomenal opportunity. And if not for that, I'm pretty sure I really would not have gone into family medicine, mainly because I didn't have any other exposure. That really wasn't what I grew up with, and it wasn't what was happening at Emory at the time. So that was probably one of the pivotal moments for me, was working with Dr. Andy Morley.